Hello and welcome to our special coverage on chikungunya and its sudden outbreak. You can call in with your queries on chikungunya or dengue and other vector-borne diseases on the numbers that we have been giving out on our screens. Now, there have been at least 10 deaths due to chikungunya in Delhi in the last few days, even though it is considered non-fatal, and it is being considered the worst outbreak in 5 years. And other states have also reported a surge in the numbers. Maharashtra has also seen about 800 such cases. There is also fear of dengue across the country. Now, today the Union Health Minister has stressed on the need for close coordination between the centre and the states to deal with the outbreak, which it seems, he says, has affected about 40,000 people between chikungunya and dengue in the country, and said there was no need for panic, but it seems that people are of course worried with the number of deaths going up, and this is what the Delhi Health Minister has also said. There's no need to panic, yet there have been 10 deaths due to chikungunya in the national capital just in the last couple of days itself. Now, joining us for more on this is Dr. Atul Kakkar, who is a specialist at the Ganga Hospital, which has seen 4 deaths in the last couple of days. Also joining us is Sujatha, the former Delhi Health Secretary, and of course you can call in with all your queries. In a short while from now, we'll also be joined by on the phone line by Dr. J.M. Dua, who is the specialist at the Apollo Hospital, which has also seen about 5 deaths. Sir, let me come to you first, Mr. Kakkar. You've seen 4 deaths at the Ganga Hospital in the last couple of days. However, both the Union Health Minister and the Delhi Health Minister have continued to stress that it is non-fatal and there's no need to panic. But there will be a certain amount of panic, given the fact that there have been deaths.
Yeah, it's been very unfortunate that we've seen death in our hospital, and perhaps we were first one to report this, and no one else has reported this earlier. So for this also, there were lots of factors which we looked into. Many of these patients were having comorbid problems like diabetes and underlying problems, which perhaps accelerated the inflammation and led to multi-organ dysfunction.
Right. So you're saying that chikungunya, was worsened by other symptoms that they also had. But what, a lot of viewers would like to know is that what are some of the symptoms that differentiate chikungunya from dengue? Because so far, everybody knows that chikungunya is not fatal, and so, but a lot of the symptoms are similar in both the diseases. Can you elaborate on that?
Definitely, initially the symptoms of both can be same. However, there are soft signs to tell whether these are due to chikungunya or due to dengue. Patients may have high-grade fever in dengue with pain behind the eye, backache, which may be seen. In patients with chikungunya, they may be associated joint pains, which is very incapacitating for the patients. That's one of the major things which helps us to know exactly what is going on in the patients.
Right. Let me also go across to Sujatha, the former Delhi Health Secretary. Ma'am, now there's been a lot of tug of war between the union government and the Delhi Health Minister, saying, well, the MCD is responsible for fogging and the MCD is responsible for prevention and other such reasons why there's been a spike. Who really is responsible, and what can be done to stop this? Because we've seen a massive rise in vector-borne diseases in the last 10 years, especially in the last 5 years.
Well, to begin with, I think we should look at this whole issue in perspective. So there are 2 parts of questions, 2 parts to your question. One is there's a big spike in the diseases, vector-borne diseases in Delhi, or in India, I don't know what you mean. And the second is who is really responsible. So let me answer the second one. Number 1 is that both dengue and chikungunya, the whole area, India and Southeast Asia, Latin America, parts of Africa, they are climatologically conditioned, and therefore it is not as if there's much more. If you see the data from 2010, there has been a steady decline in both dengue and in chikungunya on the whole, in the aggregate. But in Delhi, certainly chikungunya has shown a spike upwards. But still, if you look at the overall data, it is still in a contained mode, and I do agree that there is no need to panic, because chikungunya does not cause death. So if you listen to the doctor carefully, there were certain fundamental underlying morbidities that the patient suffered from, and chikungunya may have accelerated it and enhanced it, but it was certainly not the cause of death. That's number one. Number two is, who is responsible? Vector-borne diseases are absolutely got to be centered on the communities, in the communities, within the communities. And therefore, it has to be a decentralized approach. It's not the hospitals that have to be focused on, but it has to be preventive measures at the community level. I'm afraid in India, we still suffer these morbidities only because we've given up primary care, we've given up prevention, and all we're doing is hospitalized treatment. And this is a wrong focus, and I'm afraid media is also playing into this wrong focus. So my answer is, to your question, MCD is certainly responsible, but then MCD doesn't have adequate wherewithal, they don't have the staff, they don't have the foot soldiers, they don't have adequate equipment to deal with the size of Delhi's problem. So the investment has to be made by MCD, because they are the ones who deal with the issue at the community level.
Right, ma'am. I take your point, but it's not the media's focus alone. There has been a substantial tug of war between the Delhi government and, of course, the union government on who's responsible every time a disease comes up. But taking that point to Dr. Kakkar, Dr. Kakkar, the Delhi Health Minister has said that these are government hospitals haven't come up with any of these deaths. It's happening in private hospitals. What would you like to say?
Firstly, all these patients were transferred from some other hospital. In fact, they wanted to come here because perhaps we give better care. It's a tertiary care hospital. Secondly, the doctors also need to be aware of this. In fact, these perhaps these deaths were maybe seen earlier also, but they were not reported. But it was just the little bit more awareness on the part of doctors that let us, that at least for us to realize that we should put it in public domain that these deaths have been triggered by chikungunya, although they may have underlying lots of problems.
Right, sir. But Dr. Atul Kakkar, now we are joined by a caller, Mr. Mathur from Delhi, who has a question. Mr. Mathur, go ahead.
Yeah. Good afternoon, Dr. Saab. My maid has got the problem of pain in the leg and joints and all that. So I thought the first thing is to, only today she had reported this. So we want her to attend somebody who can understand this problem and quickly take care of that. She lives in Shahpur Jat near Oskhas. Anybody, any center there where she should go? That is the question.
So perhaps this kind of problem, there is not much, there is not much, so there is not much to panic. Any nearby government or a private place they can visit, and what is required is once you make a diagnosis of it's a seasonal chikungunya, paracetamol is required.
I would also like to add, if I may, that chikungunya, they're going to find it's a debilitating disease, and this pain will carry on for some more months, and they should be prepared for that. Unlike dengue or other mosquito like malaria, which kind of is very, very self-limiting, but this pain will, the joints, I think the joint pains will continue, isn't it, Dr. Saab?
No, almost 90% of the patients should recover in about 7 to 10 days, and about 10% of the patients may have this kind of relapsing pain which is continuing for a little longer time.